Howdy folks, Ranger James here with Kennesaw Mountain National Battlefield Park. I'm standing in our park museum where we are filming the next great installment of our highly anticipated museum tour series. This one is going to be dealing with Civil War medicine. Behind me in the display case we see several artifacts, the most important of which is going to be the surgeon's kit that we see here. It is a wooden box bound with felt, and there's several instruments inside to include saws, different sharp implements that you would need for rudimentary surgical practices out in the field. We also have, just to the left of it, many jars, which we will be talking about here in a moment. Now, we're going to be talking about Civil War medicine, or the lack thereof in a lot of cases. One thing to note, and it's sort of a big thing, but also a very small thing, is that back during the Civil War, we've come a long way since then, there was something that not a whole lot of people believed existed. And if you can guess what it is, it's something very small. We're all sort of afraid of it today. It's a germ. So, germ theory isn't something that would be implemented widespread until after the 1900s. During the Civil War, during the 1860s, this is something that's still completely new, that a lot of medical colleges, especially in Germany, they're just now getting to where they're sort of toying with the idea of germ theory, of wiping down their implements and washing them off in between patients and the like, cleaning your hands, keeping everything sanitary. So this is going to be a story, mainly tragedy, of how we learn from our mistakes in the first modern war, which is the Civil War, and we grew from that to the sort of level of understanding medically that we have today. Now, back then, the majority of medical cases that you would find on the battlefield, the majority of surgeries would have been amputations. And the reasoning because of that, it has less to do really with the germ itself and more to do with the kind of ammunition that they're using at the time. So before the Civil War, what you have is a small musket ball. It's just a little round ball that would hit you. It still hit you with some force, but prior to the Civil War, they've made a change in the technology. Now we have rifles, which are guns that have bores inside of the rifle, inside of the barrel, that allow the bullet to spin. On top of that, we have a brand new kind of bullet called the mini ball. And this is going to be about the size of your thumb. It's heavy, it's slow moving, it's subsonic, so oftentimes you can hear it coming at you, you can sometimes see it coming at you in a lot of cases. And when it hits you, it's not designed to penetrate like a lot of our bullets are today. It's designed to, if you can zoom in right here, as you can see, we have an example right here. It's a small white object, completely mushroomed out on the left-hand side. It is designed to collapse in on itself with such force that it shatters everything in the area. So this is basically a death sentence. If you're struck in the head or in the trunk with this particular bullet, if you're struck in an extremity, what it would do is it would shatter the bone in and around the area, and anything that's below that wound, at that time, there's not much that you can do to try and save it. So what they would do is they would amputate, and a good surgeon could get through an amputation in as little as 10 to 15 minutes. And oftentimes in mass casualty incidents like you would have during long, faithful charges like you had here at the Battle of Kennesaw Mountain down at the Dead Angle, you of course would have hundreds of patients under the care of a single surgeon in a lot of cases. And we actually have a letter of one of those surgeons who really got burned out from the amount of death, the amount of toil, the amount of amputations that he's having to go through day in and day out. But what they would do after the amputation, and this is where it got a little messy, is they would take a rag, they'd bind the wound. Now, to keep it from getting infected, to keep it from getting hot, what's the opposite of hot? Cold. What they would do in a lot of cases is if it began to feel like it was getting warm, they would begin to pour cold water over it. And of course, cold water and bandages and a fresh wound, I mean, that's a recipe for disaster. Oftentimes you would get gangrene that would develop, blood infections that would develop, and in a lot of cases the patient wouldn't make it. 2/3 of all Civil War casualties, during the Civil War, were because of disease. Oftentimes, as incredible as it may seem, you were in more danger sitting around your campfire with your buddies than you were out in the front line in the heat of battle. Oftentimes, these casualties and these deaths occurred because of dysentery or some other sort of foodborne illness or stomach virus that would occur, and it would just rampage through camp. You also had yellow fever that would occur, and malaria in several places down south towards the Mississippi area during the siege of Vicksburg. Dysentery especially was the big one, and a lot of that came from, again, you don't know anything about germs. So what kind of food are you eating, right? What kind of water are you drinking? There was about 160,000 men here at Kennesaw Mountain the day of the battle, or the couple of weeks that the battle took place here. And, you know, they didn't have Dasani back then, right? They were drinking out of creeks, out of streams, rivers, mud puddles, anything and everything they could find in order to keep themselves well hydrated for their long marches, for their trench diggings at night, and for the long hard fights that they'd have to endure. All of that put together really expanded our knowledge of how medicine works, especially when it comes to battlefield medicine, to trauma. And in fact, a lot of surgeons from Europe, they would come over here and they would volunteer to work in the Army, on the battlefield, to try and get some hands-on knowledge. And certain things like the use of chloroform really sort of took off because of this. Now, during the Civil War, a lot of the times, you wouldn't have chloroform, you wouldn't have anything to knock you out and make you feel pretty while the doctor was doing his best on you. What you would have, as you can see by these jars, sometimes you'd have whiskey, if you were able to get it. Oftentimes you would have laudanum, which is a mix of opium and alcohol. But in a lot of cases, if supplies are running thin, especially for the Confederates, they would often have to rely on the stoutness of the patient, if you can guess what that is. And that's where that old saying, bite the bullet, comes from, because they would literally give them one of those soft lead bullets, the mini balls, to chew down on while they were having to operate on them to try and deal with the pain. Well, I hope that this was insightful for you. I hope that you learned a couple of things. It's always the gruesome stuff that people find the most interesting. But come back next time for another installment of our museum tour. We hope to see you at the mountain.